Hey friends, you're watching BrainStormAcres. I'm Henry.
And I'm Irene.
We have a really serious topic to discuss today.
Yeah, it's where we were.
We've been gone for 2.5 days. And the reason why we went was pretty scary.
Well, I had weird physical symptoms that could have been a stroke.
If you've not really spent any time looking to see what the symptoms are for a stroke, I strongly recommend that you go online to WebMD or any other online medical service that will tell you the symptoms of a stroke.
Right now,
of a stroke.
That's one of them, actually, not being able to speak correctly. 10 years ago, I had gone to the hospital because they were concerned I had had a stroke.
I was in California, and I got a call from Irene. She was being loaded into an ambulance in Ash Fork and going to the Flagstaff Medical Center.
Right. One of the things you need to do if you live out in the middle of nowhere is be aware of where you have a real medical center.
Yeah, we live an hour and a half from the medical center here. And the problem with that is if you have a major medical emergency, let's suppose you are having a stroke.
Right.
You have a relatively short window to get from where you live to the hospital for them to diagnose you and determine whether or not you're eligible for a TPA treatment. That's a specific kind of clot buster that's used to help mitigate the problems of a stroke. Now, when Irene told me what she was experiencing, it was something in her vision. And she did the smart thing. She closed one eye.
And check to see if it was in both eyes or just in one eye.
And then she closed the other eye, and it was in both eyes.
Right, so if it's just one eye, that usually means it's actually optical. It can be something else, but a lot of times it just means it's optical. You need to be aware of things like retinal detachment. When you get older, the gel that's in your eye, the aqueous humor, can dry out slightly and actually stick to the retina. I had that happen, gosh, probably 10, 12 years ago, maybe?
A while ago, anyway.
A while ago. And that's a simple, literally like a minute and a half with a doctor. I mean, you have to do all the setup. You have to go to the special office. It takes forever to get out of the waiting room. But once you're actually in with the doctor, it's like a minute and a half with a laser. And they zap that, and you have the patch on for 24 hours, and then you're fine.
But that's a whole lot different than a potential stroke or potential heart attack.
Right. But it is important to know all the different things. So if you're aware, like we have family members by marriage who have had multiple retinal detachments. They know what the symptoms are, and the minute anything like that happens, they call their doctor and they're right on it.
Because early treatment on a lot of these things makes the difference between a good outcome, a poor outcome, or a horrible outcome.
Right, exactly. And because sometimes with a retinal detachment, they can stop it before it detaches all the way if they can get to it fast enough.
So going back to strokes, there's multiple kinds of strokes. There's what could have happened was called a transient ischemic stroke.
Right, which means it's something that goes away by itself. But you need to be aware that if you've had something like that, it could happen again, and maybe it won't be transient the next time.
And it could continue.
Right.
You know, strokes happen because things happen. A lot of times you get a clot that closes off one of the arteries in your brain. And now a lot of your brain has, the best way of describing it is what one of the neurologists said was it's like a cul-de-sac. There's one-way flow of blood and there's no way coming back. So it diffuses out into the brain. And when you close off that cul-de-sac, all the nerves that are associated with it start dying.
Yeah, yeah. So the same, we know now that it was the same thing. 10 years ago, I was taken to the hospital.
It was not a stroke.
No, it was not a stroke. They did every test under the sun.
And nothing was the matter.
Nothing. I mean, they even put me through a serious stress test, and the whole 9 yards. Nothing. They couldn't find a darn thing was wrong. Maybe, yeah, I needed to lose 10 pounds. I still need to lose 15. But, it's like, other than that, I mean, there was nothing. They did CAT scans. They did MRIs. They did every normal test. There's some new ones now that they can do that they didn't do then, like the, what do they call that stuff? On the carotids and stuff.
You do Doppler on the carotid arteries, and that can tell you whether or not there's plaque buildup in those arteries that are slowing the blood flow to the brain. Now, your brain is served by 2 sets of different arteries, the carotid arteries that come up the front, and then you have 2 arteries that come up the back. The arteries in the back are what service this part of your brain. And guess what? That's the part that does your visual processing.
Right. You would think that it would be the front because it's close to your eyeballs, but it isn't. When you actually think about how far back your eyeballs go in, those nerves are going to the back of your brain. At any rate, we know now that what had happened 10 years ago is the same thing that happened this time.
Now, one of the things that Irene described to me, and the reason why I told her to get dressed, we're going to Flagstaff.
We were sitting there in our pajamas.
And I was not going to accept any other answer other than, yes, we're going. And she said yes. And she got dressed right away, and we got going. It's important to get to a medical facility quickly. Irene's 70, I'm 69. We're at the age where things start going wrong. Well, we're actually older than things start going wrong.
No, considering that probably half of our graduating classes from high school are dead, I would say that things have gone wrong.
One of the problems with this kind of medical opportunity that we experienced was that you'll start having some symptoms that fit multiple medical conditions.
Well, it's kind of like the descriptions we've been getting of some of the new viruses and generalized diseases that are out there. Oh, cough, sore throat, this, that. I'm like, that sounds like everything from the common cold to something that's going to kill you. I mean, there's so many vague symptoms that it's not like you can say, if your left pinky turns blue, this is,
So what did you say that caused me to tell you, get dressed, we're going?
Well, I was seeing lights in both eyes, and I could not see the television. It was so bright. And the previous time that I had been taken to the hospital, it was not that effect. It was some of the other effects that showed up later. But I now can look back 10 years ago and say, same darn thing. And when I finally saw the neurologist yesterday, he's like, if you'd come in this morning
instead of yesterday,
I could have busted you out of here in 10 minutes.
Well, that's not true.
It's not true, because they still would have done some tests and stuff. But the basic problem was the previous day they had a lot of trauma patients in. So when you have somebody who comes in with an active stroke going on, loss of sensation in half of the body, things like that, that person takes priority over everybody else that is a maybe.
She was a maybe.
Yeah, and they had multiple life flights come in, and I mean, it was bad. So it's just that, timing on things.
But the point of being in the hospital, in the emergency room, was if there was an ongoing stroke issue, she was where they could treat it on the spot quickly.
Right. And I mean, and they did everything. They did the CAT scan, they did the MRIs.
She got to have the gadolinium, which makes you feel nauseous.
It makes you feel nauseous, and it makes you feel like you peed yourself.
And
lovely.
What I loved was the taste in my mouth.
Oh yeah, it tastes terrible. The guy said, "You should be tasting this." Yes, I do. There were a couple of times when they did something like that. They're like, "We're injecting the saline out. Can you taste the salt?" I'm like, "Yeah, I can," which is a weird thing to be able to say. You can taste the salt from an injection, but you can.
We went to the hospital, and she saw literally every medical professional that they had come through the ER, and then later on to her private room.
Right.
She saw the occupational therapist. She saw a speech
therapist. Well, they're checking you all the way along, and I have to warn people that, of course, my hearing aids had lost their batteries by that time. They were dead. So I'm like, okay, I wear hearing aids. The batteries are dead now. So talk loudly. It was a quiet room, which was helpful. But it was, and I speak slightly off center because I have been deaf most of my life in one ear. So I have a tendency to speak towards the right side of my head because it's kind of like when you're in a choir and you're trying to figure out exactly what voice is yours and you're trying to make sure you're on pitch. You tend to cover an ear and you'll kind of cover your mouth sometimes so that you can actually hear yourself in comparison to everyone who's around you. So that tends to have long-term effects for people who have deafness on one side.
So she saw all those professionals and
a parade.
She saw the chaplain.
Yeah, so the chaplain comes through. Everybody came through. It was very nice. I mean, everybody was lovely. The staff up there was freaking amazing. I only met one cranky person the whole time I was there.
So what did they finally diagnose, Irene?
The neurologist came in yesterday, and I mean they've given me a clean bill of health on everything, you know. And you're just going, okay, that's good. I mean, it's good because you know they've checked this and it's good, awesome. Now they've checked this and it's good, awesome. And you're going, okay, so we've run out of awesome.
The problem is that leaves you with, what's the cause of this problem?
Right, and I never got an answer last time.
Well, 10 years ago there was no answer. Structurally you're healthy.
Right, structurally you're healthy. We don't know what caused it, but I never saw a neurologist 10 years ago. But this time has marched on.
Well, this year because she went in with a potential transient ischemic.
Yeah.
They immediately tagged her as a potential stroke patient.
Right.
Which meant they queued up all manner of professionals who deal with stroke.
Right. And he walked in and he goes, how you doing? And I'm like, well, all the tests have come back clean, but nobody's got an answer. He goes,
I have an answer.
I have an answer. You got a migraine.
Have you had migraines before?
I have. I've just never had this kind. But one of the things he talked about was that migraines can change dramatically over the years, and they normally do mutate sort of over the years. So as a small person, you might have had stomach aches, and that they found there's a certain type of abdominal pain that some children get that has nothing to do with your abdomen. And if you were to do a whole GI series and everything else, everything will come back
Everything's
negative.
perfect.
Everything's perfect. Nothing wrong with you. It is a migraine. When people think of migraines, they think of really painful headaches that are debilitating. You have to go sit someplace dark and all that other kind of stuff.
That's me.
Yeah.
And when I get a migraine, I'm pretty much useless. I don't have issues with seeing auras or having problems with bright light. Mine is pretty much all related to sounds.
Right. You can have migraines can produce auditory illusions, so you can hearing things. Henry will hear some things sometimes. It can produce olfactory, so sinuses.
Which I get.
He smells cigarette smoke when there are no cigarette smoke. Yeah, and that's a disgusting thing for a non-smoker. So I have had migraines before, but I have had the kind that your head feels like it's going to explode and you can't tolerate light and you need to just go sleep it off for 6 or 8 hours. And that was a pretty rare thing for me. It happened a couple of times to me as an undergraduate, maybe once as a graduate student or something. I think in our marriage, maybe twice, 3 times max.
Not very often.
In 49 years, you know. So it's not but those are dramatic things. Those are the things that you know you've got a headache and everything. And that's what most people think of when they think of migraines. But there's all kinds of migraines that don't produce any of those effects. And what I had was a acephalic, that means not painful because it didn't hurt, migraine that is what they call additive. In other words, when you have a stroke, you usually lose something.
Well, as a result of my accident, I lost a quarter of my vision in both eyes.
Right.
And that's from a bleed in my brain.
Right, on the optic nerve. Now, with strokes, you're usually losing something. You're losing muscle control, you're losing nerves in some spots. They'll touch your skin. Can you feel this? Does it feel the same as this? That sort of thing. With the migraine, in this case, it's an additive process. So it's not that I've lost any vision, it's that I've got extra stuff in there that didn't used to be there. And my description to the physician, because he asked me, he said, describe to me what you saw, and I said...
She was describing Joan of Arc.
I was describing an arc of points, which is what they call it in the literature, in the medical literature. I've already read some of it.
We didn't know any of this when we
No,
went.
I told the doctor. I said, the patient and retired archaeologist in me is thrilled by this information. In other words, the patient is happy because it's an answer, and it's something that you know that can be worked with, lived with, survived with.
It's a pretty benign answer.
It's
It's
in
not
comparison to anything else that you could possibly think of, because you're thinking, oh God, what else could it be? You know, because the two major causes for stroke is either something in your brain or something in your circulatory system that's causing problems in your brain. So you've got blood clots, you've got this, you've got plaque. You know, I've got a little teeny bit of plaque, but it's not narrowing the arteries. So, okay.
bonus.
You know. They expect everybody at the age of 70 to have plaque. So to hear it's not a narrowing situation is awesome. But I'm seeing an arc of points. So it's a zigzag like this, and those points are all made out of light, and each piece of the point is made out of a separate piece of light. And it's and it's in both eyes. It's identical left to right, and it's identical in terms of visual brightness and all that other stuff, bright enough that I can't see the TV.
So I need to let you know that for the next week or maybe 10 days, our publishing schedule is going to be off and on, because so far this week we have 2 more doctor visits that we have to go to, and that's an all-day affair. As you know from some of the previous shows that we've done, when I go to Flagstaff or I go to Prescott, it's pretty much an all-day event. It's 8 hours at least out of the day, and it's going to be more when we go up to Flagstaff for her medical appointments.
Right, because I have an eye appointment tomorrow, and that's going to. I also need to talk to him about my cataracts. We know I have cataracts, and it's really affected my night vision. I can't drive at night anymore, which is problematic. And
that means I get to drive at night. And
right.
Mostly what I decide, because she has the difficulty with cataracts, I really don't want to create more stress for her. So I argue in favor of finding a place to land earlier in the day rather than later. Well, normally I'd rather just wait until 7 or 8 o'clock at night, get something to eat, go up and go to bed. And
right. Well, the last couple of years, as we've gotten a little older, we tend to light a little bit earlier anyway. Even when I was traveling by myself and I was much younger, driving the truck, I liked to be done with dinner and in the hotel before dark. If I couldn't manage that, I wanted the hotel and the restaurant to be in very close proximity and be in the hotel as soon as dinner was done.
To bring this all back to the beginning of why we're doing this show, when you live rural, and if you're taking more than half an hour to get to a competent medical facility,
and I emphasize competent. We know people who lived near a military base in southern Arizona, trusted them, and she's a widow now.
Yes, so more than half an hour from a competent medical facility, you live virtually rurally.
Yeah.
When you live rurally, you need to make sure you know how long it's going to take you to get to different places, how long it takes to get an ambulance to either your place or somewhere along the route. You don't have to necessarily wait for an ambulance to come to you if you have a good driver who can get you somewhere up the road.
Right.
So there's a lot of things that you need to think about when you're going to live rural, which is what we do.
When we first moved out here, there were no four-wheel drive ambulances in the area, and they still have a minimum quantity of them, so there may not be one available. So they may say, we can't come out to where you are, you have to get the patient to us.
And that happens quite a lot out here.
Yeah, and there is a life flight location that they can land at the entrance of our subdivision here. The church there has a landing pad.
Helipad, right.
Yeah, but you need to be tuned into that, and if you have issues or are concerned about issues, you need to consider getting a contract for transportation, because if you wind up with a
life flight, you can spend $100,000 on medical transport.
Yeah, so because we had a medical transport contract for a number of years out here. we did drop it eventually. But, you know, you need to consider that. We know somebody who in eastern Arizona who has had to give up their property. And he was doing the whole off-grid thing.
It was going great,
Yeah.
and then his spouse had not one stroke,
But multiple.
multiple strokes, and which meant that he needed to be closer to a hospital. And that's
Yeah.
a hard decision, but you know, when you're going to live off-grid, if you're going to live rurally, you need to seriously look at those conditions for yourself
Right.
and decide, what do I need to do? Where do I need to live? It's really important. If you care, if you don't care, well, I suppose that you can kick the bucket most anywhere.
Well, yeah, I mean, there's people out here who have.
Yeah.
Plenty of them, unfortunately.
The last thing I'll say is that Irene's neurologist warned her about something that might happen in her 80s.
Right. She said there's a different effect, a kaleidoscopic effect that you can get. It's almost always in your 80s. And I said, well, I'll look forward to that in another decade or so. He thought that was funny. But it's, you know, it's the kind of thing that there's stereotypes about migraines. And you see all the migraine meds, and the person's always going like this. Oh, their head hurts. Oh,
That's
the
not
lights.
all
You know,
of it. And
that's not all of it. There's all kinds of migraines.
So, what I would encourage you to do is become familiar with the life-threatening conditions that you could run into.
Check out what your family's done in the past.
And have some contingency plans. It's not all, let's see, roses and rainbows? Is that what the one person said?
Yeah, it's not all roses and rainbows.
All the time.
Yeah.
I love seeing the nature around us. I love seeing the clouds. The sunsets, the sunrises are fabulous.
Right.
But that comes at a cost.
Yeah, oh, it does. I mean, you know, if I won the lottery, I might go someplace else that was a little less remote, but still had that because you could afford the place that would get, you know what I mean? But it's what you can afford in many ways.
So, well, thanks for watching. Don't forget to hit like, subscribe, and ring the bell for notifications. There's a lot more to come. Definitely, seriously think about the health conditions that you might run into or
Right.
family might run into, and really talk it out between you.
Yeah, I
There's
know a lot
no-
of people don't like to talk about this stuff, but the reality is, at the age of 70, we've buried, not personally as in we dug a hole, but as in we have had a whole bunch of people die in the last year.
a lot of very good friends. But
Right.
that's not the purpose of this.
No, but you need to be real.
Have a serious conversation with your partners, your family, your close friends, if you're living in that kind of environment. It does no one any good to not know what the conditions might be. If you care, if you don't care, that's your decision.
I mean, some folks have a very fatalistic attitude of when I die, I die. Other people are like, I kind of like to hang around as long as I can. You know?
I want to hang around. So, well, thanks very much. We'll talk with you sometime later. Don't forget to keep brainstorming because...
Obviously, we are.
And I'm really glad that she has a diagnosis for this most recent event
And 10
the one
years
10
ago.
years ago.
That has been 10 years that's been bugging me, seriously.
And it's something we've talked with her primary care physician about, and it's really going to be nice to go in and say,
Yeah.
we know what the cause was 10
Yeah.
years ago.
Well, the neurologist says it's amazing. Like if you go to an ophthalmologist and you give them descriptions and stuff, they'll do all the tests, they'll do all the pictures, and they'll tell you, I have no freaking clue what that was. And he said they should know that by now.
So-
because this is classic out of a textbook.
We'll talk with you later. Bye.
Bye.